Hello, and thank you so much for joining us for this session of the Veguary Vegan Pledge Program. I am so delighted to have today one of my favorite people, Dr. Terry Victor, and we're going to be talking about holistic dental health. So I just want to go ahead and read his bio and just tell you a little bit about Dr. Victor before we get started. Dr. Victor graduated from the Howard University School of Dentistry in 1998. He completed his general practice residency at St. Elizabeth's Hospital. Dr. Victor has a vision of creating a practice where the patient's needs are primary, where dentistry is integrated into the overall health of the patients, and where the structure of the practice promotes sustainability. With those things in mind, the DC Dentist was created. Wow. So thank you so much, Dr. Terry Victor, for being with us and for sharing with us today.
Oh, thank you so much for having me. I really appreciate being here.
And I don't know if you knew that you were one of my favorite people, but
Thank you.
with the Vegan Soul Fest and having you come out and you support us like every year, and
Yeah,
you come out and you speak, and people are always very excited because nobody is talking about, dental health.
yeah,
Nobody, and so people come specifically to hear your talks.
yeah. We love the Vegan Soul Fest, and I miss it so much.
Me too.
My staff was always very psyched about going up there, and all the events. And it's interesting how every year we see it getting larger and larger, which is
Oh,
a
yeah.
testament to the work that you guys are doing.
Yes, thank you
Yeah,
so much. Thank you so
yeah.
much. So, what is your favorite thing about being a dentist?
Well, a lot of times, but my favorite thing about being a dentist is just the helping of the people. A lot of times people come to a dentist with issues, like whether the issue is like, they're in pain, but the issue doesn't even have to really be pain. The issue could be like, I don't like what my smile looks like. Or the issue could be like, can we change this? I've been missing this tooth for a long time. It's just really getting to be an issue for me. And you're able to solve those people's problems. And for me, there's nothing like seeing that person after you solve those problems, whether it's an aesthetic issue or whether it's a pain issue, and that person's like, oh, thank you so much, you've made my life better. So
Mhm.
for me, that is the best thing about being dentist. The other best thing about being a dentist is that a lot of times when people are anxious and they come to the dentist and then they see what it's like, the difference at our office, and they're like, oh my god, I didn't even really realize it could be like that, and they're no longer anxious. To me, that is something that is really it's like heartwarming for me.
Yeah, I can actually attest to what you're saying because I came to your office to get some dental work done recently, actually.
Mhm.
And, it was just such a calming experience. Obviously, I've been to the
Yeah.
dentist before,
Hmm.
and not quite so calming those
Yeah.
other experiences.
Yeah.
But coming down there and like the full service, even just the energy of the people
Yeah.
in the office, like everything just really puts you in a calm state. And then just like all the holistic practices that are just so much different from
Yeah.
what you experienced at the at other dentist offices. So I really, really appreciated that.
Yeah. That's how we want our office to be, as a place of it should be a healing place and a calming place, and almost kind of like a refuge somewhere, which
Yeah.
is interesting to think of a dental office in that manner.
Yeah, I think a
But
lot of
that,
people would be surprised to hear that,
yeah,
but yeah, absolutely
yeah.
true. So what is it about holistic dentistry that was appealing to you?
Well, for me, when I got out of dental school, there was no holistic dentistry for me, and my whole life, the way that I was living my life, was based on holistic and alternative and vegan and all of that kind of stuff, and there was nothing to be found in dentistry. So we wanted to create something where people, because I know there were other people just like me that wanted those kind of options. So we wanted to create that, and we were able to create that. And I see a lot of people really have like an affinity for it because it's different than your traditional dentistry in many different ways. You
That's
know.
absolutely true.
Hmm.
So I know that this might be like a softball question, but for the folks who are participating in this program, many of them are completely new to plant-based eating. So I wanted to ask you, is there any connection between diet and dental health?
Oh, yes. There is a great connection between diet and dental health. And whether that connection is with the amount of sugar that's in your diet, or whether that connection is with the amount of processed foods that's in your diet, or whether that is even in the high volume of carbohydrates that's in your diet. Generally, you find that people that have a plant-based diet, generally speaking, their teeth are much in a much better place than somebody that has the standard American diet. And you know where you see that a lot is with children. If
Mm.
children have been brought up in the to have like a healthy diet, a plant-based diet, generally speaking, their teeth are pretty structurally and everything. Their teeth are pretty good, and then it extends to adults too. But I really see a huge difference with the children.
Hmm. That is so interesting, and I had no idea. But it
Yeah.
makes sense.
Yeah. There's been research done on that on a plant-based diet and how it is that it's better for your dental care. What it does too, um, it makes your body, I guess, less alkaline, so that you're able to. The saliva in your mouth is like antibacterial. So if it's working very well, then it can keep a lot of your cavities and that kind of stuff at bay. But if it's not working very well, then what ends up happening is that you kind of like then there's more likely a chance of having cavities and that kind of stuff.
Oh, okay. All right. So are there any foods in particular that you would consider detrimental to dental health?
Oh gosh, of course the sugars, right?
Mm.
The
Mhm.
sugars are probably the worst things that you can do, because what the sugars do is that they promote the bacteria that's in your mouth. We all have bacteria in our mouth. What the sugars do is they provide food for and fuel for the bacteria. So when they eat the sugars, they also eat our teeth. So
Mm.
that's the number one thing. Another thing that is really not that great might not be classified as foods, but a lot of alcohol. And I'm not talking about like maybe if you have like a glass of wine and that kind of stuff. I'm talking about like hard alcohol. It dries out your mouth. It dries out your mouth, and our mouth is not intended to be dry. It's just like, rubbing alcohol. If you That's what's the purpose of it. You put it on your skin or something like that. It dries everything out. So
Mm.
alcohol itself is something that's really not that great for your oral health. And the like I mentioned before, a lot of the carbohydrates. If you're like really over the top on carbohydrates in your diet, then you find that those people have a lot more, because carbohydrates break down to sugar. So you end up those people, generally speaking, might not have the same oral health as somebody that's once again, that's plant-based, and they eat fruits, they eat vegetables and that kind of stuff. Those are the kind of people I see in my practice that generally have a pretty good idea. And those people also generally have a better idea of how it is to take care of their body overall. So I think that may be kind of like one works into the other.
Okay. And when you say carbohydrates, are you talking about like breads and pastas and stuff like that?
Breads, yeah, pastas, rice, and those sorts of things. If you do those things in excesses, generally speaking, it's not that great for your teeth.
Interesting.
Mhm.
Okay. I think people are really gonna learn a lot today because I know I am. Um, so, what feedback are you getting from people who are experiencing these kinds of holistic dentistry practices for the first time, like when they come to your office?
Yeah, I think they kind of have like the same reaction that you have. Generally, it's like, why didn't I find you like 5, 10 years ago? Why? How's it? I'm just learning about you now. Like they're like indignant. Why should we be keeping this a secret?
Yeah.
So the response has been really, really good. I think that people are looking, especially in this day and age, people are looking to get away from a lot of drugs, a lot of chemicals, a lot of surgery. They're looking to do things a little bit more naturally. And I think the dental part of it it hasn't really caught up to maybe some of the other parts of medicine. So this is all fresh and all new. And, we're having a good time doing it, because people are very, very receptive to what it is that we're doing, which is great.
Yeah, and you have some very kind and just wonderful people down there working with you. I mean,
Yeah,
it's
yeah.
just such a great team.
Yeah.
So,
Thank you.
oh yeah, thank you because that was just a really great experience. I actually I never thought I would see the day when I would say I can't wait to go back
Yeah.
to a dentist, but I actually am very much looking forward to going back and just
Yeah.
like rounding out some of the work and
Yeah.
really getting, because this will be the first time I will have gotten on track, right? I'm
Yeah.
always trying to play catch up. I'm always trying to like fix a problem.
Right,
So
right.
I'm
Yeah.
looking forward to actually getting ahead of the game.
Yeah,
So,
maintenance. That's the best way. That's what the best way to do it, the prevention and maintenance and getting everything done. And then that's our aim for you to be able to keep your teeth for the rest of your life
mm,
and just go on prevention and maintenance. That's how dental work should be done, on
mm.
prevention and maintenance,
And I
because you're
think,
you're taking care of stuff.
yeah, I think people do better by their cars than they do by their own mouth
Yeah.
when it comes
Yeah.
to prevention and maintenance, right?
Yeah, 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 yeah.
Wow.
That's the best way to go, you
Hmm.
know.
Do you have a particular like age range of people who come into the art? Like, like what are the ages of folks who generally come?
Yeah, we have like actually a pretty wide spectrum of people who come. We get a lot of seniors, believe it or not.
Oh,
Well,
wow.
I'm not saying seniors, but people maybe like in their 60s and maybe later, and maybe they've had like not so great experiences at the dentist in their lifetime,
Mm,
and they've heard about us or they referred to us, and they just seem to have like a really good experience, because their previous experience has not been that great. And then we also get like middle-aged people with children, and then so now we're starting to get more children in the practice. But we get like a full spectrum of people. People seem to really be receptive generally, and overall they seem to be receptive. You
yeah.
know. Hmm.
Yeah, I always used to be so stressed out about that x-ray machine, the
Hmm.
regular x-ray machine that they have in
Oh
dental
yeah,
offices because it's like all this stress, like, you know,
yeah.
everybody runs away and like get to sign something, and like so even
Right.
the machine that you're taking these images isn't
Yeah,
even like that. It's just
yeah, yeah.
everything about it was just great. Yeah.
Yeah, yeah, yeah. No, it's good. I'm glad that you
Mhm.
found that the X-ray machine was good.
Yeah, definitely. So, if someone wants to start practicing more holistic dental care, what kinds of products, what kinds of ingredients in products should
Yeah.
they specifically be looking for?
Oh, great question. So what I would say is that if you want to start practicing holistic oral care, then one of the things that you really need to do is there's products that you can get. I want to tell you the things that are good. You should get like a good toothpaste that doesn't have any sugars in it, that it doesn't have any sodium lauryl sulfate in it, that it doesn't have any alcohol in it. So you get a toothpaste that's all natural, and you read the ingredients. If there's anything in there that you don't know, that's really long with like a number at the end of it, then you need to move on to the next one that you can use. So the toothpaste is important. And then I would also recommend like a mouthwash. The same with the mouthwash. No sodium lauryl sulfate, no alcohol, no sugars in there whatsoever. And if you're able to do those two, and to really make sure that you do some flossing is very important as far as dentistry and maintenance goes. Flossing is very important. So what I want you to do is to make sure that you floss at least once a day. It is probably the most important thing that you can do in order to get into prevention and maintenance and to be able to keep your teeth. So the mouth rinse and the toothpaste and the flossing, those are two things that are very important that would serve you very, very well.
Wow, thank you. Well, since I
Mhm,
left your office, I have been staying on top of all those things. I can't
mhm.
say that I was staying on top of all those things before coming to
Yeah.
your office. I would love to say that I've just had like perfect dental hygiene my whole life, but
Yeah.
the reason why I was coming in would let you know that I had not. been,
Yeah.
doing right.
Yeah,
But
but you
yeah.
know what? You're not the only one that it's probably one of the things that because people generally don't like going to the dentist, so it's one of those things that kind of like gets put to the side as far as what it is that you need to get done. So it's not you're like not the only one, but because what we try to tell people is that you need to include oral health in your overall health because your oral health can have such a huge impact on your overall health.
Mm,
So with your audience, they are like they're vegan. They're they go to the store. They make sure they buy the stuff that's healthy for them. They make sure that the stuff that they put into their bodies is good. But then you also need to a big part of that is making sure that those things that you have that's in your mouth is not detrimental to what you're putting into your body, so
mm,
that you don't have you're buying organic stuff and doing all that stuff, but at the same time you have like inflammation in your gums, you have your teeth are broken,
mm,
all of those will impact your overall body health. And we want people to be healthy overall, not
yes.
just, and that includes your mouth also, because you have so much bacteria and stuff that could happen in your mouth if you don't really take care of what's happening in there. So that's one of the philosophies that we have: overall health as well as good oral health.
Well, I'm just let you know right now. As soon as this is over, I'm gonna go do my mouthwash. I'm gonna brush. I'm gonna floss. Like, I'm feeling so motivated.
But
So, I mean, we've talked a lot about, like the reasons that bring. Well, we haven't talked a lot, but we talked a little bit about the reasons that bring people to the dentist office.
yeah,
What would you say is the biggest mistake that
yeah.
people make with their dental hygiene?
The biggest mistake I would say that people make with their dental hygiene would probably not to do it on a regular basis. Sometimes what happens is that we tell a patient, let's say, okay, your gums are bleeding. We're going to clean everything up, and I want you to use floss like every day, and make sure you keep everything clean, everything healthy. And then they do that, and then they come back and they're like, oh yeah, and you look at it and everything's like really good, and then maybe you see them like 6 months down the road and they kind of like falling off. It's just like with a lot of things, sometimes those things that are good for us and that are working for us, sometimes after we do them for a while, we kind of put them aside, kind of like exercise. It's
Mm-hmm.
like, why did I stop exercising? I was feeling really good when I was doing it. And why did I stop eating so well? When I was doing that, I had lost weight and all of that, but it's still kind of like got put to the side. Dentistry, I think, is kind of like the same way. So I think that what if we're able to keep once again prevention and maintenance, if you're able to get into prevention and maintenance, it's really it's a less expensive way to do your dental work. It's a less there's less anxiety involved, and it's just a matter of just coming to the hygienist and me taking a look, having conversations, making jokes, and that's it. You're set, and then you don't have to worry about a whole big procedures and that kind of stuff. I think
Right.
that that's the biggest thing that I see.
Okay. So yeah. So being consistent.
Being
Um,
consistent.
So there are going to be people who watch this, and I'm sure there are people who come to Vegan Soul Fest and meet you at the table or, sit in on your talk.
Mhm.
And they are somebody who just has had so much trauma with the dentist, or just,
Yeah,
sometimes your own family and people in your environment sort of put that fear into you as a
yeah,
child, or the
yeah,
culture does, right?
yeah.
I mean, who
Mhm.
hasn't seen Little Shop of Horrors? I mean,
Yeah, yeah, exactly. I've seen it. I've seen it.
okay, that's a whole
It's
other
actually,
conversation. I've got to get
yeah.
your input on what you think about Little Shop of Horrors. But
Yeah,
so what would you say to somebody who does have those kinds of fears, who,
yeah,
sees this and they feel inspired to come, but
yeah.
they're scared?
Yeah, I mean, I could really understand the fears of people coming to the dentist. I've had some patients that have just been so traumatized, not maybe from their people telling them stuff, but even by a dentist. And they were traumatized when they were younger, and they get in the chair, and it's like they're right back to where they're 7 years old again, and just kind of like reliving that because it was so traumatic for them. And I understand that. I think part of what it is, people anxiousness at the dentist is maybe like a lack of a lack of really connecting with the dentist, and a lack of maybe like a trust, or a lack of knowing that that dentist is really going to take care of you. And I think what I've found is that if you're able to provide those things for those people, then what ends up happening is that they end up trusting you, and they end up relaxing, and they end up knowing that you take care of them, and that you wouldn't do anything to hurt them. So one of the things that we always tell our patients is that we'd never do anything to never work on you if you are in pain, or if you're uncomfortable, or if something is bothering you. And that doesn't just go for pain. If you have like an issue, let's kind of like work it out so that we can kind of get you to a point where you're relaxed, and you're feeling that that you're being taken care of, and that the person that's taking care of you know that you have some kind of self-worth,
Mm,
right? So that it's not that I'm not just like looking at somebody, and I'm not just looking like at a set of teeth in a chair.
mm,
There's a person attached to that, and that person brings all of that person's self into this interaction that we're having, and we need to be able to deal with that. Because if you just treat that person as that, oh, here comes the cavity that we're going to fix, here they come walking down the hall. It's not so. You can't see a person like that, because there's so much more to that person. You don't know what their experiences are, and you have to take that in consideration if you're going to treat them as a human being, you
mm.
know.
That is beautiful.
Yeah,
You got me tearing
yeah.
up a little bit over here. It's so wonderful. Wow.
Yeah, yeah. That
For
that
that.
and I would think that is how I would want to be treated if I went to a practitioner. I'm not just a number. I'm not just an insurance claim form. I'm not that. I'm a person. I'm a human being.
Mm-hmm.
And all that comes with that.
So this isn't scripted, this next question. But I just gotta know, Dr. Victor, how is your dental hygiene? Like, be honest with us right now. Like,
Oh,
do you
okay,
practice what you
yeah.
preach?
Yeah, you know what? I need to because what ends up happening, let me tell you what ends up happening, right? Because I'm so busy doing dentistry that I don't have as much time as I would like to actually get work done, because I need to get work done, right? I need to
Okay.
get like my oral hygiene and that kind of stuff. So the good thing about it is that I have practitioners here, right? So
Mm-hmm.
if there's like so I just saw Dr. Daniel the other day for some of the work that I need to have done, and I need to get my teeth clean. So when I have a minute and the hygienist has a minute, I could jump in there. But I need to be honest, I need to be more diligent, right?
Okay.
Just like I was telling you about people falling off, sometimes I fall off also, even though I'm like right in the midst of it,
Mm-hmm.
and I have people here that can do the work for me. But the office is busy, I'm busy, sometimes they're busy, and to ask someone to stay after work to work on me, I kind of like feel a kind of like way about that. But I sure that they wouldn't mind. But I need to kind of like get it when I can get it when I'm here.
Yeah. Well, thank
Yeah,
you for that honesty. It really
yeah,
like
that's
makes you
honest.
seem like a real person,
Yeah,
not just like
yeah,
super dentist, like
yeah.
you're real. Okay.
Really not. Yeah,
All
really
right.
not.
And I
Yeah.
and I hope that you at least can get a discount on your dental. I mean that's only right,
Yeah.
Dr. Victor.
I should ask for one. I've been paying full price.
Oh
I should,
no.
I should ask for a discount.
So, okay, now everybody who's watching this
Oh,
in the
that's hilarious.
DMV, they're gonna want to come there, obviously, just
Yeah.
like tons of people who come out to Vegan So Fest are gonna want to come there. So how do they find you?
They can find us. Our address is 509 11th Street Southeast in Washington, D.C. We're not very far from Capitol Hill, is where we're at. Our telephone number is 202 Once again, 202-544-3626. You could reach us on the web. Our web address is the DC Dentist, THE, dentist.com. And those are the ways that you can reach us.
Awesome. Awesome.
Yeah.
So, again, thank you so much. I know like you're super busy, and I'm always appreciative that you make the time like
Oh no.
to come
Yeah.
and,
No,
and,
I
and
I
do stuff
I
with us.
make I make time for you guys because you guys have like the same philosophy.
We
You know, I
do.
support I support those people that support me. You know, I support those people that support my what it is I practice and what it is that I believe. So, it's nothing for me to do that, because you guys support us also.
Oh yeah.
So there's we have to have mutual support. We have to support each other because we have a particular philosophy and we have a particular way of looking at the world and seeing the world, and others might not. But that's the way that we see it, and that's the way that we live our lives. So we have to support each other. But I thank you for having me on. I really appreciate it. It's always a pleasure to be with you.
Thank you. So that
Yeah.
is Dr. Terry Victor, the DC dentist in Washington,
Yes.
DC. And it's always a pleasure, and I hope to work with you more.
Oh, certainly.
And we'll have like all kinds of panels and just all kinds of good stuff that we can pull you in on and get some
Yes.
more of your expertise. And I'd like to say
Yes.
thank you so much to all the folks who are watching this session of the Veguary Vegan Pledge program. Thank you so much. And I hope you learned a lot. And we will see you for the next session.
Okay. Thank you.